Away from Rivers State, let's turn to Borno, where government has disclosed an outbreak of cholera with a staggering number of 451 cases recorded so far. This was disclosed by the State Commissioner for Health and Human Services, Baba Malam Ghana. Although the ministry is currently vaccinating those taking refuge in camps, the United Nations Children's Fund says the situation in the camps is dire, hence the need for development partners to put all hands on deck to complement efforts of government. Over 100 cholera cases have been so far recorded across the camps in Maiduguri, according to Unicef.
You can see we have quite a number of displaced people, thousands of them, who are displaced by floods. But the most concerning situation right now is the cholera outbreak. The numbers seems to be increasing, and we are here to ensure that the spread doesn't continue. We are supporting the government of Borno State, Department of Health, who are already responding here. And we have some stabilization center, we have a clinic, so they are able to identify patients and treat them and do isolation. But most importantly, they have done cholera vaccination.
Thanks for staying with us. Experts in the malaria response are urging for a shift in the treatment of malaria through the use of only artemisinin-based combination therapies, which are the recommended treatments for uncomplicated malaria cases globally. They insist the use of monotherapies is prohibited by law and not the treatment or cure for the disease. Kemi Balogun has more.
Malaria remains a major public health concern in Nigeria. It has the highest burden globally, with the risk of transmission existing throughout the country. Globally, malaria accounts for 249 million cases annually, with an estimated annual death rate of 608,000. In 2023, Nigeria recorded 27% of the global cases and 31% of all deaths. These experts at this second edition media chat organized by the National Malaria Elimination Program are highlighting that once a malaria test is positive, treatment should be only done by ACTs, as the continued use of monotherapies cause severe consequences.
Most of the countries that have eliminated malaria, they do not use medicine, but they eliminated malaria by environmental sanitation through advocacy, communication, and social mobilization.
In country, the recommended treatment for malaria is the use of ACTs, and that is artemisinin-based combination therapy. That is what we use for testing for treatment of malaria in Nigeria. And as we all know, in country, there are different parasites. When you call the Plasmodium falciparum is what we have, it's higher in the country. So that is what is more common, and ACTs are able to completely eliminate the parasites from the blood system.
They believe that with an effective case management intervention through prompt diagnosis and treatment with recommended antimalarial, a reduction of malaria burden is in sight.
The approach to malaria control is not a one-glove-fits-all. No, it's a combined approach. It's always important that we test every fever case that comes to the hospital. Okay? It's very, very important we test, just so that we're able to accurately or treat the disease, confirm it, and then treat it appropriately.
Despite the progress made in the control of malaria burden, which has moved from 42% in 2010 to 22% in 2022, more still needs to be done to ensure that Nigeria meets the target of eliminating malaria by the year 2030. Kemi Balogun, TVC News, Abuja.
The Minister of State for Labour and Employment, Nkeruka Oyejiacha, says all is set for the ministry to launch the Renewed Hope Labour Employment and Empowerment Program, LEAP, this month of October. The minister, who spoke at a program organized by her ministry, said LEAP is part of the continued efforts at revitalizing the nation's economy and creating jobs to stem unemployment. According to her, the program is aimed at facilitating the creation of 2.5 million jobs directly and indirectly on an annual incremental basis, while simultaneously ensuring the welfare and safety of workers across the country. The minister added that the program, the LEAP Vocational and Entrepreneurship Program, would also cultivate industrial and cottage-relevant skills training for employment and entrepreneurship. Let's turn now to Borno State, where government has launched Phase 3 of its Teachers Upgrade Training Program, targeting 1,230 teachers from 5 local government education authorities. This move, according to government, is geared towards enhancing the quality of education in the state. Senior reporter Jesse Tafida has more.
A check presentation of 2.7 million naira by the state government, signaling the commencement of the third phase teacher training program. This time around, 10 days has been set aside for upgrade training of over 1,000 teachers from 5 local education authorities of Damboa, Jere, Kaga, Mafa, and MMC.
The indiscriminate replacement has made all of you to be on irregular salary grade levels. Most of you seated here with your degrees are on grade level 2 or 3. Some are on 4. Why? Because when one qualified teacher retired, 7, 8 of you were brought and the salary was divided. We all know the truth. So at the end of this training, you will be placed at your appropriate salary grade level. All this is credited to His Excellency's passion in education and human capital development.
Representative of the State Governor Babagana Zulum lauds the Education Commissioner's effort in upholding government policy and stressed the significance of teachers' commitment to complement this significant investment.
All of the speakers have acknowledged the important role His Excellency has played in the education sector and is playing in the education sector. Because he committed over 50% of the state budget on education infrastructure and education human development.
Leaders of NLC and TUC appreciated government's decision to integrate teachers who did not pass their prior training into other local government administrations. Each of the 1,230 participants will receive 50,000 naira as take-home and a 30,000 naira monthly stipend from October to December. So far, the state government has allocated 1.7 billion naira for the entire teacher training program. Jesse Tafida, TVC News.